With us from Shanghai, Deputy Mayor Madam Feng Ming, Municipal Health Commission Director Wu Jinglei, Municipal Commerce Bureau Director Gu Jun. First of all, Madam Zongming will brief us the latest news of our containment measures. Dear media friends, good morning. Now, I would love to take the floor to brief you about the containment measures and the nucleic acid testing results. Since March, this round of Omicron virus is hitting us hard. It is transmitted fast and it's invisible. Ever since the outbreak of this round of outbreak, we've gone through several rounds of screening and a large number of positive cases were found. So we are facing very arduous task of containment. According to the national requirements, we are committed to avoiding the imported cases and domestic rebound, and we are committed to the dynamic eradication of cases to almost zero. And we are working in an all-round way on the containment measures to prevent the transmission of the virus so that there will be zero case in the society at large. According to the National Neighborhood Prevention and Control requirements and the self-check, we are designing a new round of nucleic acid screening of all masses, and this will be carried out in different districts in a differentiated way. For example, based on the different levels of risk, we will divide our city into 3 districts, and there will be tiered management for the 3 districts. As to the 3 districts, they refer to the risk control area, the management area, and the preventative area. As to the preventative area, it refers to the places that there have been 0 positive case within the last 14 days. It includes the neighborhoods, the natural villages, the entities, and public places. Our goal is to reduce mobility and curb any gathering of population. Within the administrative region, you could choose to move a little bit, but we have to avoid any gathering of population. As to the controlled areas, they refer to the places with no positive case in the past 7 days. It also includes the entities, natural villages, and neighborhoods. Our goal in this district is to hold those people within their home for 14 days for observation. They are not allowed to go out of their neighborhood, and they must take objects in different batches. So they must strictly conform to the self-protection measures, and you could choose to walk around downstairs in the neighborhoods in different time segments, and you can pay visit to the designated places to fetch some life necessities. But in the meantime, please pay attention to the disinfection of the goods you carried up. As to risk control areas, these places refer to the neighborhoods, natural villages, or entities and public places with positive cases reported in the last 7 days. And we will have a 7-day close down management. They are not allowed to get out of their doorstep, and all the services required will be paid and delivered to their doorstep. And there may be some dynamic adjustment to that control measure and containment measure according to the actual situation of the virus transmission. During the risk control period, we must also guarantee the medical needs and the life needs are met. And we must ensure that all of those different levels of medical institutions are open to the public. Especially, we must enhance the communication between the neighborhoods and the hospitals in order to receive the special groups and patients in a timely fashion. Since March, our civilians are aware of their role in supporting the containment measures, and We've heard your call, and we share your feelings. We are still inadequate in a lot of our tasks, falling short of our civilians' expectations. But for sure, we will go all out to improve our work. When I see that our civilians and the first-line medics have been working hard around the clock, we are touched. I would love to give my sincere thanks to all the civilians for conquering different sorts of difficulties in your coordination with us. And I would also love to express my gratefulness to the CDC members, the medical staff, the police, the neighborhood members and personnel, and volunteers for your continuous fight to protect this city and our home. In addition, for the sister provinces, municipalities, the PLA members and people from all around the country who've been supportive of us when we are in the most need, thank you very much. We are deeply grateful to all of you. COVID-19 prevention and control is coming to the critical moments. We are not allowed to drop our vigilance. We still need to control our mobility and take stringent measures on the containment so as to cut off the transmission in the fastest way and eradicate the cases to zero in the society. We are convinced that with our common efforts, we will surely conquer this virus. Once we are persistent in that effort, we will come to a full win. Thank you. Thank you, Madam Zong. Next, Mr. Wu Jinglei. Good morning, everyone. Now, I'd love to introduce the basic information. On April the 8th, the 1,015 confirmed cases are added, and 22,609 asymptomatic carriers are found. As to the confirmed cases, 301 were found in the closed loop, and 294 were found among the risky population. 420 were used to be the asymptomatic carriers before. For the 22,609 asymptomatic carriers, 21,859 were found in the closed-loop management. The others were found among the risky population. As to the 1,015 confirmed cases, there were 532 males and 483 females. There are 348 in Pudong and 160 in Jiading, 140 in Xuhui, 108 in Songjiang, 62 in Minhang, 45 in Jingshan, 42 in Jing'an, 41 in Huangpu, 29 in Baoshan, 24 in Qingpu, 21 in Putuo, 20 in Changning, 18 in Hongkou, 12 in Yangpu, 12 in Fengxian, 3 in Chongqing. And as to the epidemiological survey and the experts' counseling and their clinical expressions, as well as our real-time test and imaging results, they were confirmed as the mild cases of COVID-19. As to the 22,609 asymptomatic carriers, their details will be published on our official website. Please refer to our official website for more information. As to the asymptomatic carriers, after the review of our CDC branch, they were tested positive after nucleic acid testing. And we have found 196,113 close contacts Among them, 160,210 were found negative through the nucleic acid test. 166,210 were found negative. And all the others are being tested right now. So for us, we are running against the time and fighting against the virus. This is a very critical moment. For us, we are left with very limited time. We must work around the clock and speed up our efforts to cut off the transmission. We will do our screening through antigen test and nucleic acid test. And we will intensify our medical resources pooling and combine TCM with Western medicine in order to intervene earlier. We also pay special attention to the pregnant women, the children, and the elderly people, and we will enhance the prevention on the medics. We will put high premium on the health status of the medics, and we will do science promotion as to health protection, so as to boost their awareness and capacity of self-protection. Thank you. Thank you, Mr. Wu. Now we open the floor to questions and answers, and please identify yourself before raising the question. From line number 14. Thank you, from Shanghai TV. My question is, in the recent days, there have been the citywide antigen and nucleic acid tests. The positive cases are concentrated in some areas. So what are the areas receiving the concentration of positive cases? Thank you for the question. Since March the 1st, we have continuously held several rounds of screening, either through nucleic acid test or antigen test. Since April the 4th until the end of the 8th April, we have cumulatively screened 95.27 million people, and we've tested 94,400 people are positive. According to the screening results, recently every day the city receives a very high number of infected people, and the cumulative infected people was so high that 5 districts rank among the top. Pudong New District, Minhang New District, Xuhui District, Huangpu District, and Jiading District were the top 5 districts, witnessing the largest number of infected people. And in the whole city, we are seeing a regional concentration of positive cases, especially the entities and the old villages or settlements that has a higher density of population. Thank you. Next question. From line number 10. Thank you. From the Liberation Day. Because of the risk control, some civilians are complaining about getting the prescription of some chronic diseases. So what are the ways out, and what will be the role of TCM in solving that issue? I will take this question. During the risk control period, the prescription of drugs is challenging for civilians. So for the civilians in need of medical services in the risk control areas, the village or neighborhood committee will have the grid type of management. The local medical institutions will have to have a full idea of the medical needs of their civilians. For some civilians, they have chronic diseases. They are in need of some drugs, for example, for hypertension, and so on. So the neighborhood committee will send some volunteers to buy those drugs for the civilians. They will go to the neighborhood and community level health service centers or clinics. As to the drugs for the chronic diseases, we have a very long term of prescription validity. The longest validity period of such a prescription could be 3 months. For some drugs, the grassroots level clinics may not be able to prescribe. For example, the community level health centers. Some people are suffering from psychological diseases. For those drugs, the village or community level committees will register the information on behalf of the civilians, and then they will set up such a special team to go to the temporary hospitals in order to fetch those drugs. And also we have online channels to prescribe. But as we know, because of the risk control recently, especially when the warehouse of the drugs is within the risk control areas, and when the delivery men were contained due to different reasons, that may have some influence over the time needed for the delivery of the drugs. It takes more time, honestly speaking. So there may be a delay of getting the drugs. And we are now working together with the logistics platforms so that there will be more delivery services to be offered to the civilians. With different communities and medical institutions, we are working very hard together. You just now mentioned that in the treatment of the infected people, what is the role of the TCM? In the past years, we've always paid attention to the role of TCM in preventing and treating the COVID-19 viruses. For example, in the designated hospitals, the public health centers, and Huashan Hospital and Ruijin Hospital, there are some first-line workers from the discipline of TCMs. For example, the public health center, we selected over 20 TCM doctors to participate in the overall services. As to the temporary hospitals, we are also giving full play to Shanghai TCM base in the prescription, especially according to the clinical diagnosis and treatment guideline version number 9, we are prescribing the traditional Chinese medicine accordingly. For the positive cases, if they go to the temporary hospitals, or for the close contacts, if they are paying visits to the community level clinics, we can render the traditional Chinese medicine. And that utilization rate is about 98%. For the pregnant women, there will be some patches to be attached to them. That's the non-medication intervention measure in the TCM. And it's adaptable to the pregnant women. And right now, we find that the administration of TCM can shorten the time period of one disease, and it can cut off the progression of this disease. For example, the mild cases and the asymptomatic carriers will not further progress to the heavy diseases. So TCM is truly playing a unique role in our practices, and based on some data we collected, we have reasons to believe that TCM is playing a very important role in prevention and control of COVID-19 viruses in different age groups. For example, the elderly people and the children, we are using the TCM on a wide scope. That's all I can share. Thank you. Next question. From line number 21. In some key areas, the risk control has been carried out for about over 1 month, and there have been some complaints, for example, the difficulty to get some vegetables and food. So how to solve this problem? The most frequently complained issue is about the difficulty to get some food. That's mainly about the delivery services in the city. According to our knowledge, some neighborhoods have been contained for a very long time. People's needs have changed. They are in need of more prevention supplies and basic necessities, especially for the vulnerable groups like the pregnant women, children, and elderly people. They have special needs. Right now, as to our capacity of guaranteeing supplies, we are releasing such capacity gradually. For the last 100 meter and the last 1 kilometer issues, those two are acute problems right now. So we will work on the following to guarantee the supplies. First one is to lock in the warehouses. We pay attention to the production areas, and we are connecting with Yunnan, Shandong, Inner Mongolia, Jiangsu, Fujian, Guangxi, and other production areas of pork and vegetables in order to lock them in. And there are minister-level coordination mechanisms to smooth away the cross-provincial logistics. There will be contact-free delivery. Jiangsu, Kunshan, Jiaxing, Pinghu, and Xijiao International are the transfer stations for the delivery services of those life necessities. We also resort to railway and road transportation in order to deliver the life necessities to the city. Secondly, we will open as many stations as possible. The different entities responsible for the supplies are put in our list. Different e-commerce platforms, the central kitchens, and some other circulation stations must be opened as much as possible in implementing the requirements of COVID-19 prevention and control. The different service stations must be open and in operation. For example, the warehouses of the e-commerce platforms, the supermarkets, the franchised catering businesses, and the other shopping malls, in supplying those life necessities, they should be in operation. Even though they are closed to the public, in order to avoid gathering of population, they must be still in operation for the supplies. Up until yesterday, there are 9 frontline warehouses of the e-commerce platforms, and 7 supermarkets are open. So we will encourage those different outlets to be open gradually. And as to the number of services offering, there must be a sequencing. And as to the personnel working in those responsible suppliers, for example, in the community levels, we ask them to return to their post. And for those personnel contained in their community, they can play a certain role as well in guaranteeing supplies. Yesterday, there were about 1,096 more personnel were on the post. And the city's distribution of resources require delivery men from, for example, the China Postal Services and the Shunfeng company to work hard on the citywide delivery. And fourth, different people must play the fundamental role to support the left alone elderly people and the other vulnerable groups. So there must be such contingency plans to offer supplies to those people. Based on the unit of the buildings in the community, they must have a screening of information as to the needs of the civilians. And as to the key areas, there will be some entities responsible for the supplies. For example, Bailian Group and Guangming Group, responsible for Pudong and Puxi districts respectively. And based on the unit of the neighborhood, there will be some cagers and the property managers and volunteers who set up a special team of services to supply the needs for the civilians to solve the last 100-meter problem. And when necessary, we will offer some medical supplies to those personnel. We are deeply aware that the 25 million civilians' life necessity need is the basis of fighting against the virus and winning this battle. We shoulder heavy responsibilities, and we will conquer different difficulties in order to guarantee the life necessity supplies of our civilians. Thank you. Next question. Line number 4.
谢谢主持人，我是光明日报记者。我的问题是。
Thank you. From the Guangming Daily. There have been over 100,000 infected people right now. So what is the status quo right now? Will there be any shortage of medical resources for the treatment? Thank you for the question. Since the outbreak of this virus, we have categorized our treatment plans, and we stepped up our treatment of the infected people. For the children, the pregnant women, and the oncology patients, and some patients suffering from severe symptoms, they were enrolled in the designated hospitals. For the mild cases and asymptomatic carriers, they were being contained in the temporary hospitals. Ever since March the 1st until the end of 8th April, through the combination of Chinese medicine and Western medicine, a cumulative of 10,000 patients have been discharged from hospitals. Now we have 8 designated hospitals in the city with a total number of 8,000 beds. In the next 2 days, including today, there will be another batch of designated hospitals to be put into use. As to the already established temporary hospitals, there are 100 of them, with a total number of beds of 160,000. In the future, based on the change of the pandemic, we will store enough resources in the designated and temporary hospitals. Since there has been a spike of newly added cases, we are in shortage of the medical personnel. In 10 provinces, they have dispatched their medical team to support us immediately. They will help us in nucleic acid test and treatment, and that was a great help, and we are sincerely grateful for that. Thank you. The last one question from line number 8. Thank you from the Phoenix TV. My question is to Director Wu. We learned that for some already cured patients, they said that when they were discharged from hospitals, they were refused to go back home by their community. So is that risky? Thank you for the question. For those cured patients or the discharged patients or those out of their medical observation, the moment they were discharged, of course, according to the version number 9 guideline or other criteria, they conform to the criteria. The CT value in the last 2 rounds of nucleic tests of those people must be over 35. That means 2 times of negative results of nucleic acid tests. But between the 2 sample taking, there should be at least 24 hours of time difference. If they meet this criteria, they can be discharged, or they can get out of medical observation. And once out of the medical observation or discharge, according to the national requirement, there will be some health management rules. First of all, before being discharged from hospital, there will be the disinfection of his personal belongings or personal luggages. Secondly, for the wastes produced by this person or some other disposable items, they will be taken as medical wastes for disposal. Once returning to their residence for health observation, we recommend them to stay in a single room alone if the conditions allow, and try to avoid contact with his family members and eat at a different time frame from the other people, and pay attention to wash his or her hands frequently. But the question is, are those people potential source of infection? Is it risky to let them go back? According to our clinical observation, those discharged patients or the asymptomatic carriers out of medical observation, once they meet the criteria, there certainly are some antibodies in their bodies. So according to the experts, we haven't observed any further transmission of viruses through those discharged population. That's a very key piece of information. So we hope that you don't need to worry about this group of people, and do not discriminate against those once infected people, especially among the family members. It's totally unnecessary. They're not harmful or infectious, according to the analysis of the experts and our disease control study. There have been no precedent of that infection. Thank you. That's the end of today's presser. And as to the updates, we will publish them as early as possible to the public later on. If you have any other interview needs, please go to the municipal level health commission and the municipal government. Thank you for watching.
辛苦了。